Hi everyone, today we're talking about the black eye. So, black eye, there are two types of black eye. One is caused by a direct local injury to the eye area, and the other is probably caused by some injury to the head or the scalp. So, black eye, which is due to the injury to the scalp, is called raccoon eye. And I'll explain you what happens exactly here. So basically, collection of blood in the layer of loose connective tissue. So your scalp has five layers. First is the skin, then you have the superficial fascia, also known as connective tissue. Then you have the this is the aponeurosis, which is also known as aponeurosis galea. Then you have the loose areolar tissue. Loose areolar tissue is your fourth layer, and then you have the pericranium. So pericranium is the bone. So this is the very sensitive, dangerous area of the scalp. Dangerous because it has emissary veins. So any infection of the scalp, it can easily transmit via the medullary veins into the cranial venous sinuses. Anyways, that's a separate thing, but it was necessary to mention that here. Moving forward, right now we're talking about the black eye. So what happens is that loose areolar tissue, it doesn't have any definitive stop. It doesn't have, so what they're trying to say, they're saying that the blood may extend anteriorly into the root of the nose and into the eyelids, as frontalis muscle has no bony origin. Because we have a frontalis muscle and it has no bony origin, because of which the blood can travel all the way into the root of the nose as well as into the eyelids, and resulting in black eye. The posterior limit of such hemorrhage is not seen. This is a very important line. If the bleeding is due to local injury, the posterior limit of the hemorrhage is seen. So, if the bleeding is due to local injury, this means that someone hit the eye directly. If someone hits the eye directly, that is known as periorbital hematoma. In this, there is direct injury to the local area of the eye. In the case of raccoon eye, what happens is that the injury is caused at the scalp or at the head region. Someone probably fractures a bone of the skull or anything like that. So what happens? The blood travels all the way from there, and since frontalis muscle has no bony origin, it is free to flow into the base of the nose as well as the eyelids. So that's raccoon eye, and then the other one was periorbital hematoma, which is due to local injury. And for periorbital hematoma, the bleeding if, is occurring due to local injury. The posterior limit of hemorrhage is seen. There is a posterior limit of the hemorrhage. But in raccoon eye, there's no posterior limit of the hemorrhage. There's just because this keeps on spreading and spreading, because obviously this is caused by the skull injury. This will keep on spreading. But here, there will be a certain uh, region in which, for example, someone's fist came into contact with. So only that region where the fist came in contact with, that will have the bleeding. So that's why the posterior limit of hemorrhage is just seen in periorbital hematoma, but it's not seen in the raccoon eye. Here I have a direct comparison, and also these are the images for you if you want to see. This is the periorbital hematoma, which is caused by local injury to the eye. And usually, in most cases, periorbital hematoma is just in a single eye. Because if someone hits, they're hitting probably just in one eye. The chances they can hit in both eyes as well, but usually that's one way to differentiate. In raccoon eye, it happens in both the eyes, and also it has no posterior limit, right? Okay, so the cause of periorbital hematoma, local trauma to eyelids, and the mechanism would be local bleeding into the eyelid tissue. It's usually unilateral in one eye, appears soon after the injury. Its posterior limit is clearly defined. Extent of bruising is confined to the eyelids. Associated signs would be local pain and swelling. Obviously, there would be pain and swelling in that certain area. And clinical significance is it's a minor injury. But for raccoon eyes, if it appears in two eyes, the cause is basal skull fracture, especially in anterior cranial fossa, and then the blood tracks from the skull base to the periorbital tissue. That's the mechanism. And then there's no bony origin of the frontalis. That's the reason it is able to flow to the base of the nose as well as the eyelids. It is usually bilateral. It appears after 12 to 24 hours. So initially, when the person is impacted, he or she experiences that injury to the skull, they do not immediately start seeing black eye, but it gives a more of a delayed appearance after 12 to 24 hours. And the posterior limit is not defined because it keeps on spreading. Extent of bruising is that it extends beyond eyelids. Associated signs are CSF rhinorrhea is runny nose, battle sign, and anosmia is probably the it is the loss of smell. And this is a serious intracranial injury. So yes, that's about it.